Everyone, today we are going to discuss about the celiac trunk and the branches of the celiac trunk and how it supplies the contents of the abdomen just below the diaphragm. So the celiac trunk arises from the abdominal aorta, just at the point where the aorta is entering into the abdomen through the aortic hiatus present on the diaphragm. So this right here is the celiac trunk, the origin of the celiac trunk. So this celiac trunk, and it's going to give out some branches into the abdomen to supply the organs. So if we notice here, there is one main branch arising, and a second branch and a third branch. So let's look at this branch arising from the celiac trunk is directly going into the organ present right here, and this, my friends, is spleen. So a direct branch arising from the celiac trunk is going from the posterior side of the stomach into the spleen. This artery, this branch of the celiac trunk, will be known as the splenic artery, which is supplying the spleen. So we can see that there is another branch of the celiac trunk going to the right side of the body, and this right here is the common hepatic artery. So this is the common hepatic artery. Okay, so and also the third branch arising from the celiac trunk is going upward, and it's making a curve, a C-shaped curve, and then it's returning into the upper portion of the lesser curvature of the stomach. So this branch right here is the left gastric artery. This is the left gastric artery. Also from the left gastric artery, you can see some branches are arising and going upward, and these branches are supplying the distal part of the esophagus, which is above the stomach. So you can say that this is the esophageal branches. Which are arising from the left gastric artery. So the three major branches of the celiac trunk is the left gastric artery, supplying the lesser curvature of the stomach, the upper part, and the splenic artery going directly into the spleen, and the common hepatic artery, which is going to divide, and we're going to look into it right now in a moment. Okay, so the common hepatic artery is going to further divide into two main branches. So the first artery is the hepatic artery proper, and the second artery is the gastroduodenal artery. Okay, so the common hepatic artery branched into two branches. One going towards the liver is the hepatic artery proper, or the hepatic proper artery, and the second going towards the duodenum and the pancreas, which is the gastroduodenal artery. So now let's look at the hepatic artery proper. So first of all, the hepatic artery proper going towards the liver is going to give another branch, and this branch is also will go to the lesser curvature of the stomach and is gonna supply the stomach wall. And this artery, this branch arising from the hepatic artery proper, which is going to the lesser curvature of stomach into the inferior portion of the lesser curvature of the stomach. This right here is the right gastric artery. Which is going to anastomose with the left gastric artery coming from the upper side arising from the celiac trunk. Okay, so now the hepatic artery proper will go directly into the liver and is going to divide into two arteries, the left and the right branches, which is going to supply the left and the right lobe of the liver. And also from the right branch of this hepatic artery proper is going to arise another branch which is gonna supply the gallbladder and the cystic duct. This is called the cystic artery. Okay, so now let's talk about the splenic artery. The splenic artery, just before entering into the spleen, is going to give a branch which is gonna supply the greater curvature of the stomach. And this right here is the left gastro-omental artery or the left epiploic artery. So the left gastro-omental artery. Okay, now let's talk about the gastroduodenal artery. So we had the common hepatic artery arising from the celiac trunk, which branched into the hepatic artery proper, which we have seen, and the gastroduodenal artery. So the gastroduodenal artery is further going to give a branch to the duodenum, which is called as supraduodenal artery. Okay, so from the gastroduodenal artery, a branch is arising supplying the duodenum, which is known as the supraduodenal artery. Okay, now the gastroduodenal artery is further going to come down and is going to form the pancreatico-duodenal artery, which is going to supply the part of the duodenum also and the pancreas, and which has two branches, the superior pancreatico-duodenal and the posterior pancreatico-duodenal. Also from the pancreatico-duodenal artery is going to give a branch which is also going to supply the lower part of the greater curvature of the stomach, and this right here is the right gastro-omental artery. So the right gastro-omental artery arising from the pancreatico-duodenal artery and the left gastro-omental artery arising from the splenic artery is together going to give the blood supply to the greater curvature, the side of the greater curvature of the stomach, and they both is going to anastomose here, just like the left gastric and the right gastric arteries were supplying the lesser curvature and were anastomosing. So this is all about the celiac trunk.